Let's talk about schizophrenia with leading psychiatrist.
Hi, I am Dr. Anjali Nagpal. I am a consultant psychiatrist. I have 3 clinics by the name of Serenity Clinic, and I also work at Max Healthcare. So I have been awarded Global Best Mental Health Leader for 3 years consecutively. And I have worked at University of Maryland, where all these rating scales are made, and that is why because I was working at schizophrenia related disorder clinic at University of Maryland. So that's why my interest is so much in schizophrenia. So there was a time when we were trying to find out what is the genetic association of schizophrenia and the genes which are there. But then we found out that you cannot specify any particular genes for that. And it is something, it depends from one population to the other. So today I'll be talking about what is schizophrenia. So this is a very complex sort of disease, which invariably, it occurs in about 1% of the population, and it may start at around, say, 18 to 20 years. It has more preponderance towards men as compared to women. And the symptoms are mostly it's something, either you will have like symptoms which are obvious, which you can see, like positive symptoms, which can be delusions, wherein you are actually thinking that some unrealistic or unfounded sort of thoughts you are having, or it could be you are totally disorganized. Your thought process isn't goal oriented. There is too much of tangentiality or circumstantiality, or you are trying to put two things together. That is somewhere you are having loose association, and some sort of illogical thinking might be there. Thought block may be there. Then apart from that, hallucinatory behavior may be there, wherein you think that people are talking to you. Although there is nobody, but somehow the brain actually shows those areas where you listen towards the left side of your brain, that you actually feel that people are talking to you, or they are talking to themselves, some sort of commentary going on. They are commenting on your behavior. Then there may be some grandiosity may be there, that sometimes they these patients may feel that they are somebody really big, and exaggerated sort of opinion about themselves, or they have too much of knowledge, fame, power, or they are too morally righteousness. Then also some of the positive symptoms, you can find suspiciousness may be there. Then they may feel that somebody is coming to somebody is actually recording them. They have camera put in their rooms, or somebody is following them, and somebody is trying to persecute them, or they're after them to completely destroy them. So all these sort of symptoms may be there. They may have in their behavior with others may be grossly impacted, interpersonal behavior, and they may have some sort of sarcasm may be there, anger may be there. They may pick up fights on a very small issues. So this is the sort of positive symptoms that you can find. But after some time, if the patient has been suffering from this, then the negative symptoms also become very obvious, which may be you do not see any emotion on their face, that you feel that their face feels to be completely blunted without any emotions. Then they cannot, once as a experienced psychiatrist, we understand that there are few clients we are not able to, even if how strongly we may try, we cannot establish a rapport. So a poor rapport is again one of those factors which we see whether how this patient is actually going to be in the coming time. Then they may be socially withdrawal. They don't want to meet people. They may sometimes the flow of conversation may not be that spontaneous. They are very fixed in their thoughts. Rigidity is too much, and they may have decreased sort of fluidity, and they may appear to, they are mostly, rigid. Sometimes they may have too much of somatic sort of concern. So these are few of the symptoms that, we see if there's a client suffering from schizophrenia. But quite often when they come into our clinic, if there isn't a experienced person, they may actually overlook these symptoms and think, and, they may mistake it for anxiety or depression, because after a point, post-psychotic depression may also be there. So, but the basic thing is we have to actually go and find out the underlying cause. So it is like, if you have fever, that doesn't mean that, all fevers are alike. You have to go and find out the cause for that fever. Similarly, if a patient is sad, or if a patient is anxious, that doesn't mean it's only something to do with the sadness. There might be, something more grossly wrong with that patient, and a lot of work needs to be done. So the earlier the diagnosis is made, the better is the outcome. The once we are able to diagnose, which we do here by some sort of brain mapping and psychological assessment also, if need be, if it is in a very early stage and prodromal, we don't even know whether they have never had any psychotic episode. So very early also we can actually come to know that in coming times they may be having psychosis, or it can go on to become schizophrenia. So these are the symptoms. Then one more thing, especially for adolescents and young adults, is that cannabis is a very, very strong, reason for causing schizophrenia in those patients who are somewhere, who are predisposed genetically. So there is particular enzyme which, if it is there, then you will get schizophrenia. And while all your friends may be, doing smoking up and enjoying, you may actually land up with a bigger, really difficult sort of a disease, which is schizophrenia. And we can find out these by doing the genetic mapping. We can find out these genes, and then things can become more clearer. So anybody who already knows that they have that genes, which because of cannabis can start schizophrenia, they should completely abstain from cannabis. So these are few things that I can think of. Then once our main aim is that we have to actually bring the client to remission so that they start feeling better. And once they start feeling better, then our main aim is to somehow rehabilitate them and put them back into the normal sort of society, so that they are working and they are having as wholesome life as any other person is. So these are few things I can think of when we talk about schizophrenia. And a lot of work is being done these days on schizophrenia, and every day something or the new is coming up, and we never know, very soon we'll be able to actually diagnose schizophrenia right from the beginning, just by knowing the genetics. So I'm just hoping we reach there soon. And of course, we also do RTMS for clients, especially for hallucinations when they hear voices and all. So we act on that particular area of the brain and create an electromagnetic field, and try to actually, with 10 to 20 sessions, we try to actually stop these voices, and that actually reduces the need for medication quite a bit. So this is the sort of treatment plan that we are using these days. Thank you.